Welcome to Medical Mondays. I'm Lisa Carberg, WTNH medical reporter, and we touch on all different kinds of health topics on this report. And today we are talking about men's health, which is so important, and there are so many parts to it. And we have Trinity Health urologist Abe D'Amato. Dr. D'Amato, thank you for being with us, and tell us a little bit about what you do.
Thank you so much for having me on. I am a general urologist with Trinity Health. So I treat a variety of patients, both male and female. Of course, the issues that we deal with tend to happen a little bit more frequently in men. Men's health is a big part of my practice. That incorporates everything from testosterone replacement and sexual health, erections, as well as the ability to urinate, and then cancer of the prostate, the testicles, the bladder, the kidneys, things like that.
All right, doctor, we came out to your awesome location and we did a report, and I'd like people to have a look at this. This is for enlarged prostate, trouble urinating. Take a look.
Joseph Baddeley loves golf, but prostate issues impacted his life around the clock.
Didn't sleep very well, and I let it go on and on for a while because I'm not one to run to the doctors for a Band-Aid.
How are you feeling?
Great.
How'd you do after the surgery?
Fantastic.
Joseph finally sought relief from Trinity Health urologist Abe D'Amato.
As men age, one of the natural processes is the prostate can grow, compressing the tube that we pee through like an elephant stepping on a garden hose.
Dr. D'Amato uses these images to show patients a new treatment called Aquablation. A powerful water jet clears a path.
Removing the tissue in the middle is like pulling the cork out of a wine bottle. You're left with a nice big tube for the urine to pass through.
Joseph says it was a piece of cake and loves his results.
Everything functions normal, just like it should, like when I was a younger guy.
Dr. D'Amato says Aquablation uses ultrasound guidance for precision,
so that it knows where we want the jet, how powerful to make it, at what given point in the procedure.
Many men worry about side effects of a procedure, whether they are urinary or sexual. Dr. D'Amato points out that one of the advantages of aquablation is that it avoids other structures in the body, making for a very small risk. Right now, it is only done in a few locations in Connecticut.
So, doctor, your patient Joseph was wonderful to share his story with us, and he seemed very pleased with the results. Tell me a little bit about that. Was aquablation. Now, is this something new to the scene? Is this something very effective?
So aquablation is a relatively new technology. I believe that it's actually been performed for a little over a decade now, and it's gaining a lot of good data, a lot of good traction. It's a way of robotically removing prostate tissue for enlarged prostates. It gives us a lot of control over what we're doing, allowing us to give a maximum amount of opening, allowing a male to urinate much better while trying to prevent some of the side effects of more traditional types of surgeries. It does require some very specialized equipment, and we're very fortunate at Trinity Urology to have gotten some of the newest equipment that's available on the market. It gives us a very, very controlled surgery, and outcomes like Joe's are very, very common. When we do this procedure, people tend to do very, very well.
Doctor, who's the percentage? What is the age range for people that have enlarged prostates?
Enlarged prostates become more common as men age, and it's estimated that by the time a male is in his 50s, there's probably a 40 to 50% chance of urinary difficulty related to the prostate, and it becomes more prevalent as men get older, likely becoming nearly 100% by the time a man is 100 years old. The degree that they're bothered and how severe it is obviously variable patient to patient, but it's incredibly common, especially in the elderly population.
And what else does enlarged prostate, what other effects of it? Trouble urinating. What are the other effects?
The main effect of a big prostate is on the ability to urinate. We do know that there is a certain degree of correlation with a bigger prostate tending to cause more urinary symptoms, although it's certainly not one-to-one. I've had patients who have very large prostates on imaging, but empty fine and are not bothered and they're doing well. And I have some men who have significant symptoms, trouble emptying, and their prostates are not very enlarged on imaging. That's a more rare situation, but the main impact of a large prostate is the impact that it has on the ability to pass urine.
Okay, Dr. D'Amato, when we come back, we will talk about more aqua ablation, what kind of patients it has worked for, some of the feedback you've received, some of the equipment, and what the treatment's like, as well as other men's health topics. We are back on Medical Mondays with Trinity Health urologist Dr. Abe D'Amato. Doctor, we've been talking about enlarged prostate so far. We have other topics to get to, but we're talking more about aqua ablation. So my report with you, when it went on the website, it's what we call it blew up. It was at the top of the website for 2 days. People really wanted to hear about a new alternative. Before you did the aqua ablation, what did you do for men with enlarged prostate?
There's still surgeries that we offer. The original surgery, the gold standard therapy, what we compare everything to is a transurethral resection of the prostate. It's still a procedure that I offer. It's good in certain situations. It allows us, again, to remove the center of the prostate, opening the tube as much as possible, allowing urine to pass out. It has more long-term side effects than aqua ablation does. It's certainly much more operator dependent, whereas aqua ablation being robotically controlled gives a very standard outcome to every patient, every situation. But that is one of the options. Another procedure that exists that's good, especially for very small prostates, is a procedure called urolift, where we're able to put sutures inside the prostate, again, pulling the sides open, allowing a channel for the urine to pass through. There are many other surgeries that exist that I personally don't offer, but can be very effective. Things like Resume or prostate artery embolization, or there are robotic procedures done by making incisions in through the belly to remove very large prostates as well. This is a space where there's a lot of invention going on because it is such a common problem. There are a lot of people trying to find the next great surgery, and I think we really got a good one when they invented aqua ablation.
What do you like about aqua ablation as a doctor?
The biggest thing for aqua ablation, in my opinion, is the control that I get, how exact and precise I can be, allowing me to have a very aggressive, very big opening while minimizing the side effects and the long-term consequences of the surgery. It's something that is going to level out the playing field. That will make doctors or surgeons that maybe don't have as much experience or as much technical skill for certain procedures able to give the same outcome to all patients, which certainly nationally is going to be a big deal and very important.
Well, that's very exciting. No wonder this is getting so much attention. And you said some patients came to you after seeing the report on aqua ablation on News 8. And we love to hear that because we love to get the word out about all these new procedures. Let's talk about the side effects, and we'll go back more to aqua ablation as well. The side effects that I hear men worry about, is it urinary, sexual, what else? Talk a little bit about that.
So those are the main ones. With transurethral resection of the prostate, although we're able to provide a very significant opening, a relief of obstruction, we know that there will be some long-term consequences. The main one being what we term dry ejaculation, or the idea that when there's an orgasm, even though everything feels normal, no semen comes out. That's not dangerous to men in any way, but it can be annoying to some men. And the way that a transurethral resection is performed, that's essentially a guaranteed outcome, and it's irreversible. That would be the main side effect that we worry about. There is a theoretical risk of urinary incontinence, of leakage after transurethral resection. It certainly is reported, it can happen, but it's fairly rare. Aquablation, because it is so precise, is able to offer the same amount of opening, relief of symptoms, while trying to give us the best chance at not having any sexual side effects. And we're, based on data, anticipating about a 90% rate where men do not have sexual side effects after the surgery. Additionally, with aquablation, there is no risk of urinary incontinence. The downside of aquablation is because of the way the surgery is performed, there's a slightly higher risk of bleeding, which usually requires an overnight stay in the hospital just for monitoring. Men go home with a catheter, just like they would after transurethral resection. We're finding that there may be some short-term consequences with aquablation. During the first couple of weeks, up to a month, a lot of men complain about burning with urination, but that tends to get better, go away, and a month or so out, you're going to find that they're very happy, their symptoms have resolved, they're peeing much, much better.
Tell me what your patients say to you in follow-up visits.
They've been very, very happy. I saw a gentleman just earlier today. He's now 6 weeks out from his procedure. He was nearly in tears. He hugged everybody in my office when he came in because he's back to peeing normally and has no side effects long term from this. He's absolutely thrilled.
I just got goosebumps hearing that you can change someone's life with these symptoms. All right, let's talk about, do you like using the robot? Is it doctor friendly?
The interface that they've come up with on the robot is fantastic. It's very intuitive to use. It's easy to program and understand. We're able to see a 3D model of what we're dealing with and what we're planning to get done so that we can fine tune everything. The other thing that's been very good, the company who sold us the robot has been great sending down a representative. When we're doing the cases, there's a coach, an expert behind us making sure that everything is done the right way. They've been doing that for all doctors so far. I think eventually they're hoping that we get to the point where we do not need to have them behind us. I could probably get through a surgery without them, but it's always nice to have that extra backup, other people that are, seeing everything, watching it with you to make sure that everything is done perfectly.
And we're hearing that about a lot of robotics, people getting new equipment all over the healthcare system for many reasons, and they have that guidance. And that sounds amazing. And we got to put on the 3D glasses and see that view like a surgeon does at one story. And that was a game changer. We couldn't capture it on our camera, but we're like, whoa. This is totally amazing. All right, Dr. D'Amato, Trinity Health urologist. When we come back, we will talk all about the surgery, who's a candidate, insurance coverage, and more on patient feedback on this fairly new and it sounds like very exciting procedure for men with an enlarged prostate who have trouble urinating. We'll be right back. Trinity Health urologist Dr. Abe D'Amato is joining us now for Medical Mondays. I'm Lisa Carberg, and this is pretty exciting what we're talking about. We're talking about men's health, enlarged prostate, urination, the headaches and the troubles with it. And we came to you and profiled you and your patient from Aquablation that opens the, what would you say? You said it was like a garden hose and opening it. You explained it in very nice layman's terms, and I like that. Tell us, how long is this procedure to do?
So the procedure itself, especially as we become more facile with it, with more practice, is fairly quick. It takes a little bit of time to get a patient to sleep and positioned, but once the robot is in place and ready to go, the whole procedure probably takes less than 10 minutes. Once the ablation is done and the robot has removed all the tissue that we need to get out of the way, the robot is removed from the patient, and I'll spend probably 30 minutes inside making sure that the bleeding is stopped, that all the clots and chunks and everything that needs to come out is out. And then we put in a catheter, they wake up and they'll spend a night in the hospital. The whole procedure is probably less than an hour. and patients are going home within 24 hours.
And doctor, tell us how the water actually works.
There's a jet that goes in through the urethra and is controlled by the computer in terms of how strong the water comes out. I often tell patients that if they look online, they can see where a water jet will cut steel. And this isn't quite that strong, but the principle is the same, where a very, very focused stream of water can destroy tissue. And how fast and how strong that water is coming out is what the robot is helping us with. So I'm able to program this, tell the robot exactly what I want it to remove, and then it decides how strong the stream needs to be to accomplish that.
That's what's amazing about the robotic surgery is that you put in the information or the CT scan, and then it tells you, and then you perform it, which is amazing. Is this covered by insurance?
So the vast majority of insurance will cover this surgery. This year, it went from what we call a category 3 procedure, which was still considered experimental, a little bit harder to get through insurance. It is now a category 1, which is much easier to get approved. It has a formal code. Last year, when we were performing this, we could get it approved easily for any Medicare patient and most private payers, but it was not yet covered by Medicaid. My understanding is that that is going to change in the next couple of months, and I believe this year it should be available to everybody.
And you perform it through Trinity Health. Is it performed in Hartford and Waterbury?
Right now, the robot is in Waterbury. I believe that it should be available up in Hartford soon.
Okay, and there are, I think there's another location in Connecticut with another health system. So who's a candidate for this? What age, what condition?
So this is a procedure performed for men with enlarged prostates. Any age is a candidate. We certainly get a little bit nervous if we're operating on somebody in their 90s or over 100, although it's been done with very good success and good safety. It's really dependent on the size of the prostate. One of the big roles that aquablation plays is it has provided us with the tool to address even the largest of the prostates that we run into without having to make any incisions on the outside, which is huge. I generally will perform this on men with a prostate that is over 50 grams in size, a normal prostate being somewhere between 30 and 40. We're able to measure that quickly in the office with an ultrasound to make sure that they're the right candidate for the surgery.
Who is not a candidate for the surgery?
So although aquablation is great in terms of opening the prostate up and helping men pee better, right now it is not intended to be used for men with prostate cancer. I've been speaking with the reps. There are some ongoing studies about the potential use of this therapy for prostate cancer, but that's certainly something that is only experimental, done in very specific settings in only a few places around the country. So right now, if there's prostate cancer present, and that's some of the things that we would test for before planning the surgery, this would not be the right choice.
Let's talk a little bit about prostate cancer before we wrap up, doctor. When's screening? Who should be screened? What are the guidelines?
So the general guidelines is that screening should start sometime between age 50 and 55. That includes both a blood test, a PSA, as well as a physical examination by a doctor. The guidelines change a little bit for men that are at higher risk. So men with a strong family history of breast or prostate cancer, or men of African American origin who we know have a higher risk of developing the disease. We say that screening should start around age 45. The screening can extend lifelong. I personally will always look for prostate cancer in a male with urinary symptoms, no matter what age he's at, because it's important for me to know if it's there, it changes his options and is something that we would need to address. Generally, guidelines indicate that by age 70 or 75, screening may not be as useful. That's because the nature of prostate cancer is to grow incredibly slowly, and it can take years from the time we find it until it causes big problems. And as men get older and sicker, the utility of finding that cancer, if it's not causing a problem, is questionable. And at that point, it becomes a much more one-on-one decision with a doctor and a patient as to what's appropriate.
And you mentioned the maybe aqua ablation could be something down the road for this. Are there newer emerging options with fewer side effects for men? I know there are a lot of concerns with that as well.
So the traditional therapies for prostate cancer would be surgical removal of the gland or radiation of the gland. And those are incredibly effective, but do run some very significant side effects, lifelong consequences. One of my partners, Dr. Ryan Doran, who's also operating through Trinity Health, is on the cutting edge of cancer therapy and is starting to offer a new technology called high intensity focused ultrasound, or HIFU. This is done in the operating room asleep using incredibly powerful ultrasound waves, again, robotically and computer controlled, using imaging to know exactly what we're treating. But this allows us to treat the parts of the prostate where there's cancer present without affecting the other parts. It has many fewer side effects. There should not be any risk of erectile dysfunction. There's no risk of urinary incontinence. And there's some data to suggest that doing this may actually improve a man's ability to urinate.
All right. Dr. Abe D'Amato, Trinity Health urologist, thank you so much for being with us on Medical Mondays. We appreciate your insight and your expertise. Keep changing lives like that gentleman you mentioned and Joseph in the story. And if you would like to see Joseph's story again, and we do have more information at WTNH.com. Thank you very much, Doctor.
Thank you.